I've done tried to go live twice. And nothing would work. So, here we are. First of all, my jeans are so big. They give me a pooch. I hope I'm not going to forget anything because I wasn't planning to go live there. I was planning to go live here. So, I just took pictures of everything I need. It's kind of crazy that I'm at a library and I'm on their Wi-Fi. Oh, something's going on at the dang grocery store. EMS is out there. The cops are out there. I went and got tools. I got the light bulb and I got tools so we can do that. I'm going to have to split this up. I have so much on my plate today. I had to get an energy drink. This is a 0 sugar Ultra Paradise. It's probably not good for your kidney and liver, but whatever. Your body. I've been chilling out on the caffeine. I've noticed that makes when I'm going through struggles, it makes them worse. So I've been chilling on the caffeine.
Dysautonomia.
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 Dysautonomia. Remember that.
Autonomic. Autonomic.
I will literally learn these one time, and then I won't need them anymore. I'll never say those 2 words again. They're going to be important in a minute, and I wanted to make sure I had my facts right. So dysautonomia is a condition that occurs when the autonomic nervous system, so it's the autonomic nervous system, when it malfunctions, you are diagnosed with dysautonomia. So it is a medical condition. It physically happens in the body. It's not a mental health condition. It's not a mental health illness. It's where your body, your bodily functions, they just don't work properly. Your heart rate, your blood pressure, breathing, you're not doing those things at a normal, maybe rate, speed, and they might not be operating like they should. You also might have bladder control and digestion issues. Sorry, I want to check the comments. Hey, Andrea, about the post office, no. And let me tell y'all something. Hold on, side note, I'm so sorry. I shouldn't, but I don't want to ignore y'all. So, first of all, I get over there. It's not the typical guy that's in there. So, I'm already just like, oh, God, I hope this lady ain't going to be rude. I don't want to say she was rude, but she didn't want to do her job. First of all, I walked in there with the intention. I don't really have the money right now, but I had a feeling that my P.O. box was about to renew. You pay that every 6 months. You can pay one flat fee of $72 for the year, or you can pay $35 and some change every 6 months. So I got that P.O. box. I do believe October, but I could be wrong. Regardless, it's supposed to renew in February. So I woke up, I asked her if I had a package. She said no. She said that when it comes in, that they will put a postal slip in my P.O. box to let me know they have held the package back behind the counter, that I need to talk to them and pick up the package from them. So it just hasn't came yet. From what she said, because they didn't give any slip for me. But anyways, I was going to pay $35 to renew my P.O. box so I didn't have to go in there, next month. Like when I get this case dismissed this month, technically I can kind of do what I want, so I'm not obligated to stay in the area. So I wanted to go ahead and pay. She was not having it. She's like, you're not due yet. So I said, well, I was wondering if I could renew my lease on the box. And she's like, she looks at some paperwork. She's like, you're not due yet. And I'm like, oh, okay. And I kind of felt like I was due. I said, when am I due? It says February. Excuse me, ma'am. That's tomorrow. In my world, I got a plan. That's tomorrow for me. I couldn't believe it. I was so shocked that I got out to the truck and I died out laughing. She did not want to do her job, okay? She kept blowing me off. I asked about the package, and then I tried to pay for the box to extend it, and she did not want to do her job, okay? Blew me off, and then has the audacity to tell me that I don't have to renew till February. Girl, that is tomorrow. So hopefully, nope, try to deliver 4 times now. They must not be open to accept it. That's probably what's going on, because they're never open. They don't even open till 12:30 and they close at like 4 or 5. That's got to be happening. In that case, I don't know what to do, because I don't have anyone else to send it. And like I said, she was not trying to do her job. So like, I literally had like 4 questions and she didn't answer any of them. She didn't try to help me. And matter of fact, she wasn't rude, but I could tell that she was in a hurry to get me the hell up out of there, and she didn't want to do her job. The quickness in the responses that you get from people that, post offices, you go into, I don't know, man. I don't know what y'all be doing. When you go in for customer service at these places, they're so quick, like the girl fast food that was rushing me through when I was trying to order fast food, and a video about that. Let me call her. It's, yeah. I don't know, man. Yeah, they'll have to be open, and they're only open from 12:30 to 5 p.m. So if that truck is going by there in the morning, I don't understand how they get mail from anywhere if they ain't never damn open. Now it ain't even making sense for me. What does this post office exactly do? And why ain't they got no damn aliens up in there damn conducting business? I'd rather deal with them. They know how to get shit done, apparently. So the quickness, when they're real quick and they let you know real quick they ain't trying to deal with you at all, I hate that. Because number one, we are spending our hard-earned money. I don't care if I'm trying to order a pizza on the phone or get my car serviced at a dealership, or I'm picking up mail and have legitimate questions about a P.O. box or a bank. Imagine going into a bank and having the damn lady snap your head off. I can't stand it. It's unnecessary, and it goes to show how many people out here are truly mentally unstable, because I am mentally unstable, and I don't ever treat people that way. And if I was in a position at a post office where they make good benefits and make good money, I would be nice to the damn 2 or 3 people I had to see every day, because this is a very small place. Nobody goes in there. It's a very small place. She might have to deal with a very few minute customers every day, darling. There ain't no reason for that. And it wasn't like she had a bunch of damn mail to deliver or nothing. I don't know. I was ready to get out of there after she was rude. It triggered me. I was like, I gotta go. Like, I've been nice lately. You're gonna ruin my day because you don't want to do your job and answer my questions. I gotta go. So she said that nothing's come in. So I just, you got 716 Pine Hall Road, Pine Hall, North Carolina, 27025. I'm sure you got it right. I just, things run a little different out here. I am an hour from the nearest city, so things run a little different. Mail services, you think you're going to order some Sheen, what might take 2 or 3 weeks in the city to receive is going to take you 2 or 3 months where I am. Not only is it harder to get Amazon and stuff like that, but it's also hard to get cell phone service and towers. A lot of phones don't work out here. And also, it's a food desert, so there's no restaurants. It's the mountains, honey. A little town of just a few thousand people. That's why the cops be on me like white on rice, because they have nothing to do, and there's not many people around here that's a loudmouth like me. So, you see that? So, listen, going back to this. This is important. So, this condition. Dysautonomia is a medical condition that affects the bodily functions of the body. They just don't work properly. And it's sudden, it's chronic and progressive, and it's a mild temporary condition that is reversible. And it is, Google, It says that it's also can be a serious long-term illness, often manageable. So this girl has this. I want to just be clear that this is not a mental health condition. That's why I was pointing this out to y'all. It's very hard for me to understand. I'm not a medical professional, but there was a girl that had dysautonomia, okay? She had a medical reason for why her body didn't function properly in certain ways. Not only that, she had a few like medical, she would sweat profusely and just random medical issues, and it came from this disorder. Medical condition is a medical condition. So she goes down to Chapel Hill, right? And she goes in because she was suffering from anxiety and stuff. She says, "Where do I begin? I'm truly unimpressed with the care that I received at the Psychiatric Crisis Unit at UNC Chapel Hill." This girl looks super young, y'all. She looks maybe 20, 25. And she was a psychiatric patient of UNC Chapel Hill. She also is the same girl that suffered from this dysautonomia, okay? She says she came into the ER on Wednesday, 3/6/24. So that would have been March of this year, and it would have been exactly 3 months after I had been on their psychiatric ward. She had been dealing with extreme dizziness, fainting, and vomiting due to her disorder, the dysautonomia. We're going to call it the dysautonomia because I can't. Dysautonomia. So she has this physical medical condition, and she had came in for that because she had been diagnosed by UNC at their clinic that they have set up for patients that have this disorder. The physical illness had consumed her life and had been a major factor in the decline of her mental health. So she goes into Chapel Hill as a willing participant to see somebody on their psychiatric crisis unit. And she was immediately put into a locked triage room for over 2 hours. The room was genuinely what I thought a prison cell might look like. And I've seen these exact rooms. They do look like prison cells. They look identical to a jail cell, to a PC cell, a protective custody cell. They immediately took all of her belongings and didn't even tell her mother where she was. Her mother sat outside the room in the hallway for 30 minutes, not knowing that she was right outside the door because she was not acknowledged by anyone until she demanded to know where her daughter was. I was taken into another triage area where I sat for a day and a half, with the exception of Emily and Bethlehem and Dr. Rose. The basic attitude towards patients was indifference at best. I was sweating so badly that they had to change the bed. She says due to the combination of a hot, stuffy air with no movement in the room because of her disorder, this made her medical condition 10 times worse. So she's sweating. She already came in because she felt, and they make it worse by sticking her in this stuffy ass room, and they will not cut the air on. And they actually lied to her and said that they couldn't control that. But then shortly after, all of a sudden it cooled off in the room. Sorry, I don't know who these people are. It looks like she's naming people that were nurses on the unit because she says Dr. Rose as well. So finally on Thursday, she was finally taken to the Psychiatric Crisis Unit in the Neurosciences Hospital. They made her pull her clothes off to look things. They wanted to look at her skin, look at her arms, her legs. Let me tell you what is going on here. I'm going to tell you in a second. So they strip her. They stick her on a psychiatric crisis ward. They search her body, and she says that they are looking all over her skin, looking for things on my skin. Then they searched all of my belongings and cataloged my medication on a carbon copy medication inventory list. I suffer from severe sleep issues, so I brought my sleep medication, a controlled substance, which was sealed and self-contained in a labeled prescription cartridge, and a bag of loose pills of a 1-day supply of medication. The loose bag contained a pill that is also a controlled substance, which has been prescribed to be they were prescribed by her current psychiatrist. First of all, this girl is so young, y'all. She don't need to be on all of these medications. I can't believe she's on multiple narcotics. This is not good, number one, for young people like this. This is unnecessary. Number two, they thought she was a drug addict, which is why they separated her for it looks like 48 hours. She was a day and a half approximately. And then they searched her body. In my opinion, they probably thought she was a drug addict, and they were trying to probably figure out what she was coming off of. And yes, listen, they also, in this same psychiatric hospital, they also treat they have people that come in to detox. So this is why they have those little triage rooms off to the main of the ER, and it's on a locked hallway in the back of the hospital. And they leave you down there for a while until they take you up top. It sounds like, in my opinion, but also, girl, can I just say, let's not be rolling up into government hospitals, government agencies. Let's not roll up into the police station with a sack of pills, loose pills, okay? If it's a controlled substance, it must be in a bottle. It has to stay in a prescription bottle with your name on it. No, you can't let your sister hold it in her purse. That is against the law. If she gets caught with your narcotic in her purse, getting a felony. So let's be smart when we're handling our medications, and specifically around children. But also, this girl rolls up to the hospital having physical issues from her physical disorder, and they take it the wrong way. They go out in the left field. They isolate her for days. They don't even tell her parents where she is. They take all of her property, and then they search her body, in my opinion, for track marks. So I'm just going out on a limb, and this is just an assumption, but it's probably not a good idea to roll up in the hospital looking like a pill head without your prescription, in their bottles, and loose pills rolling everywhere. I'm just saying, it's not a good look. So I see both sides of the story, and it gets thick. So, and we're going to talk about doctors and, yeah. So, sorry, this is so tiny. So they wanted to look at her body. She says that she was prescribed these pills. They were in a random baggie. Lord have mercy. It looks like 4 days later, she was discharged. She went home and unpacked and realized that her medications were missing. Yeah, girl, they weren't in a bottle. They're a controlled substance. At that point, you're lucky you didn't go to jail for a felony, because what they ought to have done, what they typically do, is they would have took those narcotics, called the police, and turned your ass in. So, first of all, this 20, I mean, y'all, the picture is so small. She looks like a vibrant 22-year-old child, okay? This is what they're doing to our youth. They are poisoning our youth with these types of drugs, and then our youth are making poor decisions. But there's more to this, and we're going to talk about it. This girl doesn't need all these drugs. So it looks like she was discharged, and she's pissed that she ain't got her loose bag of pills. But her sleep medication was taken, which she claims was in a bottle. And she says that these sleep meds are very difficult to find in stock, and they are expensive. If what she's saying is true, they probably took those sleep meds, so she had to come back to the hospital to get more. In my opinion, I'm allowed to have that. I know that sounds crazy to think that medical professionals would play games with medications just to entice insurance money out of patients, but I can assure you it happens every day. So, and it to me, they sent me home with a prescription of Seroquel, and that is never to be prescribed for sleep. Ever. And they did not tell me that you have physical withdrawals. So, it took me weeks to come off of that Seroquel. Absolutely did that intentionally so that I would have a mental health breakdown and have to come crawling back for a new prescription. This is what they do. This is how they're poisoning people. So it says that, the sleep medication was crossed off the inventory list before she even saw the doctor. Oh, wow. Upon calling the nurses station, the night I was discharged, they said they'd look into the missing meds and give me a call back. Over 12 hours went by and no one person called us. I called again looking for answers as to the location of my cataloged personal property. Later in the day, the UNC police informed me that the crisis unit had actually destroyed my sleep medication, again, which is documented, cataloged, physical property. It was on her little physical property form. Belonging to her. The unit chose not to tell me this upon discharge. Controlled substances, my personal property disappearing and being destroyed without my knowledge is an issue. Also, their head psychiatrist is not my psychiatrist. Why was this allowed? This is what we're about to get into. So, as I said, I was talking before about how, where's my notes? How UNC Chapel Hill, they don't have clinical psychologists. They do have psychiatrists, but they don't have clinical psychologists. The difference between the two is a lot, about 7 years of school. So this is why clinical psychologists are so important to mental health services, and they're disappearing all over this country. And matter of fact, if you're a clinical psychologist and you refuse to believe that, you know, little boys can birth, or if you want to believe that little boys can birth children, then they will come for you and try to take your medical license. This is exactly what they did to Jordan Peterson, and this is why he lives in the United States now. So a clinical psychologist is required to conduct a mental health assessment as a key part of practice. Now, this involves evaluating a person's mental state through interview, observations, psychological tests to diagnose and to develop a treatment plan for any mental health condition that a person may be experiencing. These people are imperative to medicine. So UNC Chapel Hill does not have clinical psychologists at all. But also this is problematic because they are the number 2 type, they're ranked number 2 among clinical psychology. Their graduate program is ranked number 2 in the country, and we're going to get into the curriculum, what they're teaching students. Their head of their psychology department. We're going to talk about him in a little while. Sorry, I'm trying to get a better cohesive rhythm of things, y'all, but it's hard sometimes. So the role of a clinical psychologist in hospitals is to diagnose psychological, emotional, and behavioral disorders. Now, once again, the difference between a psychiatrist and a clinical psychologist is about 7, maybe even 8 or 9 years of schooling. So even though Chapel Hill has psychiatrists, they do not do any assessments in Chapel Hill whatsoever. None. So you can't go there and get, in my opinion, proper mental health treatment because they don't have the people to even offer the services. So it looks like while this poor child, Katie, was in the hospital, they just meds. They didn't give her any mental health treatment. She's there for about a week. The doctors took off of her sleep medication while she was there and raised her pain medication from 600 milligrams to 700 milligrams and expected it to make her sleep. So that's concerning. This medication is barely effective for pain management. To expect someone who already takes 600 milligrams of the medication for pain to be able to sleep with an extra 100 milligrams of this drug is laughable and unprofessional. I agree. I informed multiple staff members on numerous occasions that she wouldn't be able to sleep, and no one seemed to care, even though we all know that sleep is vital to both physical and mental health. This is the treatment you get. For me personally, lack of sleep severely affects my mental health. I also told the staff that any sleep I was getting was too light, to which they told me to get my earplugs, which are not available in the hospital, which is not helpful in any way. My roommate was told the same thing. So these girls are bunking together. This facility has a lot of beds upstairs. I think like 24 to 30. And these girls are bunking together. It's loud. And she also goes on to state how, so she's not seeing a clinical psychologist. She's had no assessment. They've locked her up against her freaking will, did not tell her parents where she was, destroyed her medication, which at this point she's locked in there. She doesn't know this yet. But they've discontinued medications that she's been on for years that other doctors have prescribed to her, which is dangerous in itself. And then they start tampering with her meds. She's not getting any sleep, and things are getting worse for her as she's in there. And you feel so isolated and alone and trapped in this situation. The only way you can get out is to get an attorney and have a fight to get you out. It's a scary situation, and you realize that most people that are working there are not equipped to be handling this type of situation, and you're dealing with mental health patients. So you got some people coming off drugs, you got other people, you know, that have physical issues, body function issues and stuff, and then, you know, it's just a shit show. And then you have all of the staff who are not trained properly. They're not educated, and they don't know, they don't care to do their job. They're not taking the initiative to help these people. Really sad. So it says, additionally, the nightly sleep protocols certainly are not conducive to sleep at all, or help with sleep either. During rounds, the staff repeatedly shine lights in patients' eyes multiple times per night. Listen, she must never been in a mental ward before, because this is protocol for safety. They do the same things in jail, and we are glad that they do. So, you know, maybe don't go to a mental ward if you don't want to. I mean, once again, she's locked up against her will, so I understand her frustration. So they come in every 20-30 minutes. They're like knocking on the door. They'll shine the light in your face, and they're not quiet about it either. And Lord forbid you ever piss off one of the nurses, they're going to make it a point to be loud and intentionally try to wake you up. And jail too. Don't piss off a CO, man. They'll starve you out. Literally, you won't get no food. You'll be sleeping on concrete. Don't piss them off. Be careful what you do. On average, my room door was left open 4 to 5 times per night after rounds were made. I had to get up numerous times per night to shut my door. I did not want to leave my door open to safety concerns, because there's other mental health patients there, men included. They mix men and women together. Among other things, the unit is so co-ed. Yeah, in addition to the doors being left open at night, the staff placed washcloths on top of their door but underneath the frame so that the doors would not lock. This is also a safety concern to me. So she's saying she couldn't lock her door. You know, there's men on the unit. Yeah, I mean, these places, I mean, I would compare a mental hospital right up there with a jail. And sometimes it can be worse. You'd wish your ass was in jail. So let's see here. So it looks like she'd been taken. So I wanted to talk about this case because this girl's on a lot of meds at like 22 years old, maybe. So it says, I've been taking stimulants for ADHD since 2nd grade. So there's a little bit of medical history there. This girl has been on drugs since 2nd grade. I currently take the max dose of the stimulant for ADHD, chronic fatigue syndrome, and for my dysonamic disorder. Y'all, listen. I can't say that. I'll never get it. I can't enunciate. So she's on the max dose. And I would think that was probably Adderall, but I could be wrong. If she's been on it this long, there's certain drugs that just ain't gonna work. So that really leaves the toughest, strongest one, which is gonna be Adderall. I don't know though. So it looks like she was completely and abruptly taken off of this medication. First of all, if she's been on stimulants for ADHD that long, that would absolutely disrupt the system. You're talking about withdrawals. You're talking about not being able to think. You could possibly even have physical withdrawals. That's a long time to be on stimulants and then to just cold turkey them off. And then let's not forget, they cold turkeyed her night medication too, which was a narcotic. Anytime we're talking about narcotics, there's absolutely going to be some sort of physical, even if it's just, fatigue, nausea, sweating, not being able to sleep, insomnia. When you're coming off of narcotics, there's going to be a physical withdrawal to that, and they are playing with this girl's life right now. First of all, she does not need to be on all of these stimulants and pain medication this young. But this is so common nowadays, and this is how they're killing the youth and getting them hooked on drugs, My opinion. So she says, I was abruptly, completely taken off of it, my stimulant. This was absolutely and completely detrimental to my mental health. When my mom arrived for a visit, I told her that this medication was being withheld, and she also had major concerns. We met with doctors, and their reasoning was that they don't like to prescribe stimulants. They don't like stimulants, and therefore denied me medical treatment that was necessary. First of all, girl, stimulant, we in an Adderall shortage, Ma. We in an Adderall shortage. There ain't no Adderall on the market, okay? That's why they abruptly, in my opinion, this was this past March, that's why, because, you know, it's cheaper to put you on Wellbutrin. It's cheaper to put you on Lexapro. And, you know, they probably got contracts with those people getting kickbacks. We don't know. Chapel Hill is one of the most notorious hospitals on the East Coast, okay? So it's legendary, and these people have money, and, yeah, they make money. So it's cheaper to completely stop the medication rather than pay for the Adderall. And I just want to say that it's around $2,000 a day, approximately, to keep a patient in this psychiatric unit. And we'll talk about that in a minute, because someone was, I don't know what to call it. They were involuntarily committed, and then their insurance was charged tens of thousands of dollars. So we'll talk about that in a minute. But this girl's medication is being absolutely disrupted, and she says that it's affecting her mental health even more. They won't let her go home. She's requesting to go home. They have involuntarily committed her, and her whole family is freaking out because they can see that the doctors are not doing their jobs. Sorry. She has a lot of stuff in here, complaints. So she goes on to say, I had multiple dizzy, near fainting, and fainting episodes while hospitalized. On one occasion, one of the doctors was in the room and saw me physically faint. He told me to lie down, but he did not tell the nurse. That I happened to see a nurse walking by my door from my bed and yelled at her that I had fainted. Then 2 nurses came in, and all they did was take my vitals and blood sugar. So it sounds like there was all these problems while she was there. She said one female patient had a seizure in the unit while we were watching the UNC and Duke basketball game. Another patient and I physically had to hold her up. She was pregnant, and while the nurses came over, this was very distressing. After the patient, a seizure, left the room, a nurse said to me, quote, she must have been a Duke fan. What an inappropriate situation to joke about. They didn't even do anything to check the baby and made her walk to her room right after, the mother, you know, who was pregnant that had the seizure. Maybe a wheelchair could have been provided. So this girl is pointing out, you know, that the care and all of these little things, you know, and absolutely, they don't want to do their job in there, and they don't know what to do. They don't know how to do their job. These nurses, the psychiatrist, it's all about less work and more money. And I think that there's 2 different sides to that. I think that the doctor we're going to talk about in a little while and the psychiatrist, I think they're on board. They're all on board to make money and push certain curriculum to the upcoming students. We'll talk about that in a minute. But the nurses, on the nurse side, they're just lazy. They just, you know, that's just generation. That's just the world that we live in. Nobody wants to do their job. So there's 2 sides to this, if you get what I'm saying. I'm reading through a lot of her stuff. She says one of the nurses refused to give a patient ibuprofen, and was joking about discharging another patient who had been there over 45 days. First of all, that is a long stay, 45 days. So it looks like a nurse was joking with this patient. Oh yeah, we're going to discharge you. And he's probably dying to get out of there. That's not something that, this is a mental ward. Are you trying to sit him off? Like you trying to poke the bear? Like, you know, and these are supposed to be professionals that are supposed to be kind. Like, you're not supposed to be antagonizing mental health patients on a mental ward. I see this girl's frustration, and I'm so grateful for this. And because of this, I went and wrote a review too, so she didn't feel alone, because she was literally the only one that wrote a bad review on this hospital. So I'm right there with you, Katie. Yep, I'm right there with you. I hear you. He was told on more than one occasion that he would be released, only to be told that it was not true. So she says, I understand that things can happen to change medical status. However, the delight taken in informing him that he would not, after all, be released was truly disturbing. I also, she's talking about the staff taking delight in torturing him by joking that he's going to be released. I also saw numerous nurses on their personal cell phones during work seeming bothered when they were asked for something. Yeah. They don't want to do their job. They just want to sit over there in the corner, eat their lunch they packed, and they play on their phones. I mean, I saw the same shit. You know, it's sad. This whole medical industry is sad. If you've been to the doctor lately, if you've had to go to the ER, you know, you've seen it recently. You've seen it. Things have changed. It wasn't just COVID, though. I think most people are like, oh, well, COVID set us back. Da, 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 da. No, honey. There's been a plan to destroy this damn medical industry from the inside out for years, and it's finally took hold through Big Farm, through gender-affirming care. You know, a decline in mental health is definitely showing, you know. So, let's see here. Poor guy. I hope he got out and he's doing well, whoever he was. That's so screwed up. I feel horrible for people. She says also, mental health clearly takes a break on the weekends. I will say this girl's comical. She says we don't do anything. We do nothing on Saturdays and Sundays. We're supposed to be doing groups. We're supposed to be doing study meetings. I told you guys we did like some music classes and stuff that were really fun. And that what they try to do is from sun up to sundown, there's different classes all day long. So you might spend an hour talking about addiction in a class. You might then you'll go eat lunch. Then you'll come out of lunch and go to like an art class that's dealing with grief or something. And they do all of these random classes Monday through Friday. But what she's saying is clearly on the weekends take a break on mental health, because this is supposed to be an around the clock effort. And I'm not saying they should run these patients to death, but clearly they need to be doing something other than just laying around, and that's what you're doing. And there's no doctors, there's no psychiatric assistance on the weekend. You're not seeing anybody or doing anything. You're literally just charged $2,000 a day for a hospital stay where you're not receiving any help. She says this is absurd to me. She said she had several mental health breakdowns on this unit, and it was terrible. People in need of mental health treatment certainly don't need a break on the weekends. I also saw patients being placed on dietary restrictions, almost like it was a punishment, and that they wouldn't provide them the proper amount of food. Going into this process, I was really hopeful that there would be multiple sets of eyes evaluating the meds that I'm on. I believe I may be on too many meds. Yes, girl. Yes, Katie. Yes. I'm on 2 antidepressants and they don't change a single one of them, even though I said I wanted them to do so numerous times. Yeah, and that's another thing. They're not going to be pulling medical records like they should be. They're not going to be... They didn't pull any of my medical records, which is absurd, okay? That's how we diagnose. That's how we come up with a treatment plan. That's how we assess patients. So, you know, it's just crazy. And I absolutely believe that they wanted to put her on more medications. See, here's what they're doing now. When you come in and you're already a successful patient on, say, something like Suboxone, like I was, then they're like, oh, well, she's had great success with Suboxone for 4 years. Let's get her on some mental health drugs that she's physically addicted to. Seroquel, Lexapro, Ativan, okay? So, and that's exactly what they did. And that's exactly what in my opinion, what they were going to do to her. They wanted to put her on stuff that she absolutely has to have every day to fill functions. You know, and something I need to mention is that I'm not going to be able to talk about SSRIs today, but something that's interesting about some of the meds that she was on is SSRIs. They've proven that there's a placebo effect with these SSRIs, so they don't work as well as people think that they work. And we're going to talk about SSRIs later this week, maybe tomorrow or Monday, because this is a lot that's about to go down. So she says that the only medication related action taken was to take her off her meds that aren't even really psychiatric meds. Yeah, girl, because they were going to replace them with some psychiatric meds. That's why they upped your pain medication. This is so dangerous. All of this is so dangerous. So she also says that she has uncontrollable movements as part of her medical condition. Remember, we were talking about that dysautonomia that she has. And remember how they isolated her? They searched her body. And I said that I thought that they probably thought she was on drugs. Well, now she says that she has these uncontrollable body movements. That also, you know, if the nurses saw that when she first come in, they could have taken that as some kind of drug use, you know, and she had a medical term for it and a medical reason why she was behaving this way. But the nurses took it the whole other way, isolated her for 2 days, stripped her down, searched her body, in my opinion, for probably needle marks or some kind of drug evidence. And she says that the head psychiatrist tried to tell her mother that her thyroid level was over the recommended limit, and that's why she was shaking and having the movements. This was the only lab they mentioned, despite the fact that 15 of the other labs were subsequently out of normal ranges. One of my liver labs was nearly triple what it should have been, and no one said a word. I had to find this out after discharge by looking through my results on My Chart, which is a UNC My Chart. It's the app that you go through. But then, but again, we were not to address any physical issues while in the psychiatric unit, unless it was slightly out of range thyroid function value. At least the unit has a slight. Hold on one second. So she says this blatant of care for mental health in an actual mental health facility is astounding. So she went through absolute hell. Okay, first of all, in my opinion, she had a medical reason why she was acting and showing signs what they were saying was mental health issues and trying to change her medications and put her on new medications. They should have never done that, and that's so dangerous, and that's exactly what I went through. Let's talk about, here it is, sorry, I'm trying to get on track here. So Matt Salome, 9 months ago, he said, I went there voluntarily for treatment, UNC hospital. They changed it to involuntary and kept me there for 40 days and charged the insurance $85,000. A total fraud. Their diagnosis was also incorrect, according to a few psychiatrists that I visited afterwards. One of the doctors was Kian Penoski. Listen, y'all know. And he says he can't remember the other doctor. So he had two doctors. Well, as it just so happens, I know who one of the doctors is. There's not a secondary name, but also someone said, this is horrible service. I do not wish it on anyone. I've been without medication for a week, and the people will not answer the phone, I guess, at the hospital. Lord. So this doctor is the head of, this doctor right here is one that was listed in the review. Hold on one second. Not a good guy, not a good guy. Evil people out here just walking amongst us. So he's the head of the psychiatry department at UNC Chapel Hill, and he's a professor. He's also vice chair of clinical affairs, and he is the assistant dean for student affairs. First of all, I gotta say, life has not treated him well, because his picture from 30 years ago looks quite different. So let me just reiterate that this hospital, UNC Chapel Hill, their clinical psychology graduate program is ranked number 2 in the nation. So we get a lot of students that go to that school that are going to be branching out into different other parts of the nation. I'm just making sure I'm not missing anything before I break into this doctor. So his areas of interest, and I think it's Ken Penna Oskvik. Listen, he's an MD, he's a doctor, y'all. He is a doctor of psychiatric disorders, medical student and resident education. So he is over teaching the upcoming generation of psychologists, psychiatry. Dr. Penske's primary clinical activity is directing the psychotic disorders inpatient unit, where he supervises residents and medical students in the evaluation and management of individuals suffering from serious mental illness like bipolar disorder and schizophrenia. So this doctor is over the psychiatry department in the hospital, inpatient care, where they allow residents and students to play guinea pig on psychiatric patients. That's exactly what it just said. Do I need to read it again? Okay. So, this is why we're seeing reviews like that, number one, but also this man, his academic interest is focused on the implementation of active learning in medical students and resident education. His teaching has been recognized with awards locally and nationally. Administratively, he currently serves as the Vice Chair for Clinical Affairs. As the Health and Human Behavior Course Director for second-year medical students, he enjoys developing innovative projects focused on the advancement of the medical education curriculum. He also serves as School of Medicine advisor, helping guide and counsel students in order to be successful in their endeavor to create their own physician identity. What you're about to witness is how they brainwash people in colleges. So I'm so excited. So let's see what this doctor has been working on in his career. Now, let's not forget, he's teaching all psychiatrists now. This is the number 2 program in the country. This is what he has been working on for the past couple of years. So this is the doctor. Let me show y'all his picture. And we're going to call that in a minute. All right. So this is him. He is over the mental health unit at UNC Chapel Hill. And he also teaches the number 1 psychiatric. He's an educator. Okay. At the number 2 top ranked college and clinical. Yeah, this is crazy. So here we go. So microbiome core facility. These are things that he has worked on in the past 5 or 6 years. This was interesting. Reducing patients' greenhouse gas emission. Interesting. You're going to see a trend in this. Utilized to prevent and control SARS-CoV transmission listen, good luck with that. And this is psychiatric health care. Climate change. Being reactive, assessing effect in the COVID-19 era. Academic psychiatry. Do y'all not see the politics in this? This is the number 2 top clinical psychiatry school in the country. And the teacher, this is what he teaches to his students. These are what do they call it? Theses or whatever. Okay. Look at the politics in this. And this is what he's teaching his students. This is psychiatry. This is not, we don't need to be concerned about greenhouse gases in psychiatry. Look at this at the psychiatry department. Look at the politics. This is the problem that we're having in schools. This prevent, this is crazy. This is politics. This is not an education. Force against climate change. And this is crazy. I wanted to show y'all, like, this is mind-blowing for me that I found something like this. So he is a leftist. He's concerned with climate change. Let me see the politics. It's crazy. Sorry, that's falling down. Let me see. So, you know, how can I put this? So he's an educator. And he allows his students to come in to the psychiatric ward, talk to patients, and help with medications and treating these patients. But let me remind you that this hospital does not do assessments. They don't diagnose mental health conditions in this hospital. They don't. This psychiatric unit, and they do not diagnose mental health conditions. And that's the problem. So we have people who are in their residency and medical students evaluating these patients under this doctor who is expected to educate them. And here's the thing. As you can see what he's worked on from his career, he's not educating anybody. He actually is brainwashing through propaganda. I mean, it's absolutely crazy. Hold on one second. These are his research works with 16 citations, including telehealth, reducing parents' greenhouse gas emissions at one academic psychiatry. What in the world does greenhouse gases have to do with psychiatry? Am I missing something? Please, am I missing something? What does greenhouse gases have to do with psychiatry? This is propaganda, and this is how they're brainwashing students. And it's happening right here by this guy, you know? And, you know, here's his work, and it's crazy. It's just crazy that it was this easy for me to find. So that was on the effect of the delivery of psychiatric health care related to COVID-19. It's all propaganda. Greenhouse gases, psychiatry department. I mean, you can't make this stuff up. Can't make this stuff up. Yes, it is. You know what's crazy is while I was doing my research for this video, because I wanted to talk about Chapel Hill after hearing that girl's story, and then finding out that this doctor is a paid propagandist, this explains why mental health services are slipping, because we have doctors like this who clearly, you know, he's over here writing theses and shit on greenhouse gas emissions and how it messes with the psychiatric department, or, you know, how it affects it's preposterous, and all it is propaganda. It goes to show that this is why people are getting dumber. A potential force against climate change. He is a psychiatric doctor. That is, you know, mental, mood, yeah, I do believe that UNC Chapel Hill has been in the news recently. I mean, you know, it used to be, look, y'all, this was his before picture. Sorry. Lord. Maybe that's karma for... He is the director of the inpatient psychiatric services. So he is the guy that is over everything, and he is a doctor. He went to the biomedical science, Auburn University. He got a bachelor's. And then he got his MD at the University of Alabama, Birmingham School of Medicine. And then he did his residency psychiatry at the University of North Carolina hospitals. It is imperative that we diagnose before we medicate. Sorry, excuse me. Why should a mental health disorder be diagnosed before starting medication? I was supposed to go live on this phone
An
and it
accurate
won't let me.
diagnosis of a mental health disorder is important before starting medication because it helps ensure that the treatment is appropriate and effective.
Not only that, it's absolutely dangerous to medicate patients without. So the purpose of a mental health diagnosis is to provide framework for understanding a person's symptoms and guide to a selection of appropriate treatments. We're going to treat schizophrenia completely different than bipolar disorder or borderline personality disorder or attachment disorder, or, and I think it's like just attachment. It's several forms of it, attachment issues. But it is important to diagnose with mental health before we medicate, and if anyone is doing otherwise, that is not a safe environment and you should seek services elsewhere. And it is crazy to me that the #2 clinical psychiatrist school in the country is doing the complete opposite of what we know works and what is healthy, and I can't believe they are being this dangerous. But, you know, this is the world now. So it looks like there's a physician, psychotherapist, Alan. Jesus, you got 20 letters in that last name, MD. He says, yes, we absolutely have to diagnose before medicating. In my practice, I always strive to have a clear diagnosis before rendering treatment. Depending on the urgency, the diagnosis may need to be provisional, but yes, how we can begin treatment without an idea. How can we begin treatment without an idea of what we're even treating? You know, when they do these assessments, they have you fill out paperwork. They ask you questions about your childhood, about drug abuse. They ask you pretty much a brief history of your life. Have you ever been abused? Have you ever, you know, they ask you all of these things, and then they also do other tests to assess your feelings, what you're feeling inside, your struggles that you might be having. If you're suffering from like anxiety, depression, you can't sleep, insomnia, you know, stuff like that, they'll ask you about those feelings. And there's legitimate tests to diagnose patients, and that's also why we have the DSM-5 is to diagnose. But once again, Chapel Hill does not use the DSM at all. And they also do not diagnose. You cannot get an assessment there. This is absolutely one of the most dangerous things that I've ever even heard of, and I can't believe it's happening almost where I'm from. And it's supposed to be one of the best hospitals in the country. And it's a hospital and it's a college, so there's two parts to it. But a lot of the students that go to school there work in the hospitals. So if you were wondering about the circumstances of this university. So we are currently in the DSM-5, this Diagnostic and Statistic Manual of Mental Disorders, 5th edition of the American Psychiatric Association's manual. If you were to look up PTSD, for example, you would see the exact criteria that you must meet to be diagnosed with post-traumatic stress disorder. You're going to have different markers, different symptoms in different patients, but there's certain criteria that you have to meet in order to be diagnosed with someone. These people don't even ask you questions at Chapel Hill. There's no conversations. There's no assessment. There's no, you're not even talking to anybody. As soon as you come through the door, they're shoving pills down your throat. It's crazy. So this assessment, typically, it lasts like 60 to 90 minutes, but for a full accurate diagnosis, it may take multiple sessions depending on the complexity of the patient's symptoms and need for further evaluation and observation over time. In some cases, a complete diagnosis could take even weeks or months to solidify. And that's because a lot of these disorders, they go up and then they go down, and, you know, a lot of things can affect these disorders. A person's living situation, a person's other medications, you know, people, places, and things, just environment. So sometimes it takes a while to properly diagnose people. That's another reason why they don't want to do assessments, because these people would have to stay longer than the typical 7 to 10 or 14 days, which is what Chapel Hill has. It's a 7 to 14 day approximately each patient. So if they were to do this the right way and give assessments and give proper mental health treatment, then a lot of these people would be staying longer for evaluation, because we would have to try different medications. So there's a process to this. It's not the cheapest process, but I have a feeling that for them, it's the most lucrative process that we currently have going, if that makes any sense at all. It's absolutely devastating to hear Katie's story, and it kind of seeing what that doctor has his hands in gives you an inside window into what he's teaching in his class. You know, if he's out here writing psychiatry reports on COVID and climate change and gas house emission, that is a complete leftist, honey. They are bought and paid for. When they are writing propaganda like that in a prestigious college, you best believe they are passing that down to their students. When I went to school for horticulture, my teacher passed a lot of leftist stuff down to me, and it happened in a prison. So I can only imagine how it happens in a university, you know? If I was that easily influenced into being part of the left, then anybody can be, especially privileged kids that, you know, don't have street smarts. If they can pull the wool over my eyes, then it's not hard to see how it could be pulled over children's eyes. And that doctor is definitely a liar. He's not trying to help patients. He's trying to do, a twin. That's something else I was talking about how disgusting a lot of that industry is. Like, it's gross, like extremely gross. I heard it's the worst profession to date. Apparently, listen, I don't want to lump people together, but apparently, you know, the police station is perverse. The medical industry is perverse. Hell, I mean, y'all know, there's restaurants popping up that are brothels. Like, the whole world has just gone mad. It's just the way that it is now. People are sick in the head, and you know, them nurses be seeing them cops 24/7 too, and because they, you know, kind of work directly. I'm sure cops go to the hospital quite a bit. I'm sorry, who's Rose? What did I miss? So let me tell you, that Rose Quartz sent me money on my Cash App, right? And then I see, y'all remember yesterday when I said people send you money just to ride on your coattails? Listen, I appreciate the money, but don't come arguing with the people that I have in my chat that come and support me every day. Second of all, you like sent me money, but then you like link my channel name to your channel because you have a channel. This is, so apparently this woman, this Rose, has her own channel. Listen, to each their own, but listen, y'all, I don't know how to say what I'm saying right now because I don't want to be mean, but I just want y'all to know that there's a lot of game playing and manipulation that comes with this channel from other people. She sent me money, and then the day later, after I thanked her on here, a day later, I see that I was like tagged in a post to her new channel. So like, it looks like I know this lady or something. I don't know. I don't know. I don't care. Listen, I'm sorry if she was running her mouth. I don't know. I just know that it was a weird sequence of events, and then I realized that she has a channel with like some followers, 2,000-3,000 followers, and she like mentions me and how she sent me money, and like, listen, I don't know, dude. I just got too much shit on my plate right now. I ain't got time to worry about this damn petty ass drama on YouTube. Ain't nobody got time for that. That's literally why I have no friends, because everybody's the fucking same. 99.9%. I can't help it. I don't make the rules. I just know I don't damn play mind games, and I don't know, man. I don't know how to put it into words. I'm real, and I don't be knowing what's going on. And that's another thing. I separate myself from people because I have to. You have to. You have to protect your sanity, honey, because people are crazy, and if you sit around trying to play these mind games and guess what the hell they trying to do to you and pull you into, that's another thing. Like, everybody just wants to get their claws in you and just hold on to you, you know, and I don't, no. I don't explain it, you guys. I don't know what that was about. I just want y'all to know that people send me money with strings attached. There you go. And you know, it puts me in a bad predicament because I am struggling, you know, and nowhere is hiring. And I just heard on the news that there's almost 10,000 different companies that are looking to file bankruptcy. What did I fucking say? 10,000 companies thinking of filing for Chapter 11. Do you know what would happen to this country if that happened? $10,000. And how are you thinking about it? The whole headline didn't even make sense. I heard it on the radio, actually. But I got to look into that. That's something we should have looked into. How you thinking about it? What are you saying? Are you trying to blackmail us for money right now to keep your business afloat? I am so confused. What you mean you thinking about it? And how you know it's that damn many? I don't know. We'll look it up. Give me a minute. I'm hungry. And I gotta change this damn headlight. Damn it. Before the sun goes down? Shit, I ain't but 2 hours. Do you know what would happen in this little town? Shit. Be looking like Western North Carolina with the buildings still standing. Them people still ain't got no damn relief. It pisses me off. It looks like they're gonna get some relief, but it ain't happening fast enough, you know. That was devastating, y'all. It still is. But yeah. I said last year, I said watch 2025 swing in and all the bankruptcies start. And then they've been going on consistently. It's not like it's, you know, past 3 years business. I mean, since COVID, it's just declined, you know. But big companies, to see huge companies like Bed Bath & Beyond, who it's probably worth billions, companies like that, to watch them go out of business, Target and Walmart shutting down stores. I need a job. Like, put me in, coach. But hell, a lot of the Walmarts are dangerous nowadays. I don't fucking want to work up in there when everybody's badass attitude. I ain't got the patience for your bull crap, sir. You know? Look at the customer service and the store being a wreck and damn high-ass prices. Imagine working in there. Well, I bet if you work there, the people are probably nice to you because they're co-workers. Well, at least it's that, like, fake frenemies at work. I guess that probably gets better because you get to know everybody every day. But it still ain't no real friendship. It's Walmart. But, yeah. That's, I hope not. But it would explain a lot. It would explain why nobody's been hiring. Shit, that went down the wrong tube. And I spit in my pants. I turned into a damn water fountain. My head is killing me. I think it's the hat. Alright, we about to pop out and pop this headlight out. I don't know what I want for dinner. I need to work on this light before the sun goes down. I got it figured out. I got to take the damn air exhaust cover off and then pull it out the pipe. And it says I can do it with the tools I got. I need fucking rubber gloves, bro. I can't touch that bulb. Okay, so, first of all, somebody said it'll explode. No, it won't. But, well, it might. I mean, it could, but it's highly unlikely. You're not supposed to touch those bulbs with your fingers because of the oil or something, like moisture or something. They can explode in your hand. Could you imagine if I would have pulled that son of a bitch out? I would have been touching it all over. I would have. I know me. I would have been rolling it around in my fingers and like... I don't even know where it's at. I was looking for it earlier. I hope I ain't lost it. It's probably in the floorboard. So I got tools. I ain't never did this before. I hope I don't get that exhaust cover off and damn came to back on. It don't look hard. It looks like there's a thingy-madoodle. Listen, I'd do good if I can remember these damn words when I had to do stuff like this once a year. It's a clip. It's like an adjustable metal band that puts the exhaust into the pipe. I'm so bad. I tried. Is it a C-clamp? It's a C-clamp. There we go. See, if I sit and think, I'll figure it out. I think it's called a C-clamp. A C-clamp. Hello, Salvador. Thank you. I just forgot gloves. Legitimately forgot it. Pulled in the parking lot and forgot it. Oh, shit. I can't go in there. I'm going to have to go to the Dollar Tree to get some plastic gloves. Thank you so much. Y'all see my attention span on caffeine? That's why I ain't been drinking it, because I get scattered brain. I'm like... I'm trying to kill that before during 5 o'clock, though. It's only 120 milligrams, and I'm already damn tweaking out on it. I'm glad I didn't get the triple shot caffeine, because I was going to get a triple shot caffeine with over 200 milligrams. I'm glad I didn't do that. I'd really be tweaking out. I done forgot that I needed gloves. So when I was looking into those SSRIs, I realized that I've been on every single one that's even on the market. Is that not wild? When I was a kid, though. This is what's wrong with me. This is why I have no memory. We'll probably talk about that tomorrow. I wanted to, like, do my due diligence on that, too. This whole doctor brainwashing students in psychiatry in the #1 medical school in the country is crazy, but, you know. Chapel Hill has not been up and up in many years. Quite the opposite. I gotta make sure I got some money. Hold on 1 second. 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 1 second I'm sorry. Hey, Kevin. What's going on? Y'all, can y'all please ignore it? I'll find it if there is. Just ignore it, because see, with you not ignoring it, you're gonna make it worse. I'm telling you. Just ignore it. But thank you, but just try to ignore it. That's why I've been trying to stay on top of the chat. I hate that y'all get pulled into stuff. No, it said on the website that you can, it'll explode. It said that your oil from your hand can make it explode, which is crazy. Don't freak out. I don't see any car stuff. My pants are way too big. What the heck? Well, here we go. I need rubber gloves. Rubber ducky. Oh, come on, man. They ain't got no damn rubber gloves. What the frick? Where else would they have gloves, y'all? Maybe the cleaning supplies? Damn it. I need like those blue surgical gloves, damn black cop surgical gloves. You know what I mean? Damn it. Son of a bitch. Oh, my ankle. They ain't got none. Excuse me. Sorry. Y'all, I don't see no gloves. I don't see any. They ain't even got no damn mittens. Oh, what about these? Oh, what about the ones for wash dishes? Yeah. Yeah. Oh, shit. They were usable. Hold on. Disposable gloves. Them huge, though, and they plastic. Y'all. We about to try these. Listen. Oh, yeah, hold on. This is what are those vinyl? That's what I need. Sorry, I was just envisioning myself under the hood of my truck with them big old yellow things all the way up my arm. Sorry. So here's some vinyl ones. This is what I wanted. Just the comments. I can just hear people rolling by being like, girl, that ain't a kitchen. Ain't you supposed to be in front of a sink? You already got the gloves on. Sorry. Shh.
But yeah, I would say see the Monday.
Girl, that ain't no kitchen. That's an engine. Are you lost or crazy? So this is what I got.
I'm gonna get you a receipt, sweetheart.
Vinyl.
You have a good day. Happy New Year.
No way, Kevin. I wonder what he was going to do. How are you?
I'm doing good. Hope you are.
Yeah.
The total is 134, sweetheart.
Thank you.
You are welcome.
Gosh. Thank you.
You're welcome.
Have a good one. All right. You too. Alright, you know. Those yellow gloves go halfway up y'all's arm. Like, they go up here. Well, I can't even show you. They go all the way up here. They look like you could darn... Never mind. Never mind. Oh, God. That caffeine's got me, like... Sorry. I couldn't get those rubber ones. I would have been setting myself up for drama, okay? I can see people rolling by now being like, girl, what are you doing? Sorry. They're so big. So those gloves come up to here, first of all, okay? And they're rough plastic. And that's a little light bulb. So I just see me with these big gloves trying to handle that tiny light bulb, asking for problems. We got vinyl gloves. Let's go figure out where to do this. God, I make myself laugh. I can't help it. Sorry. Oh. I see me out there under the hood with those big old gloves and that tiny light bulb. Bitching. Y'all know. Mad. I wonder if I should go over there and do it. Let me think. Well, at least if I fuck it up at Walmart, I don't ask for a man's help. They got a tire department. I don't think they do light bulbs, but maybe he can help me get my exhaust cover back on if I can't. Oh, at least if I'm gonna mess it up, let's do it where there's men to help me. Gotta think smarter. And they're good guys too. I've gotten my car serviced here once or twice, and one time he helped me with the battery. He had a special tool or something I needed, or maybe I don't remember. It was something with the battery. I can do it myself, but I'd like to eat somewhere that I can sleep if I can't, figure it out. If I get that exhaust cover off, I can't get it back on. I'm gonna be stuck. So it's best to just do it where I can sleep if needed, If I get stranded, at least I'm home. At least I'm stranded home. At least for the night, till I can get somebody out here to help me. I don't know who I'd call. Ghostbusters. I gotta have a better chance with that than anybody else. Oh. At least Ghostbusters might actually show up. Alright. Let me stop goofing around. The caffeine's hit me. I'm a giggling mess. Oh. So we gonna need a jacket, honey, because it's cold. First of all, where's tools? Tools. So it said initially that all I need is a flathead. We're gonna see. Okay, so the first thing we want to do is cut it off. Parking brake, which is on the ground. Push a parking brake. Push it down to unrelease it. Push it down to lock it in. Really simple. All right, pop the hood. Did I just do that? I think I did. No, I didn't. There we go. Okay, but first, it's cold. Y'all, and tell me why these damn britches are so damn big. They're cute when they're all hiked up where they're supposed to be. They're supposed to be high-waisted, but they won't stay up because I need a new pair of jeans bad. I do like these though because they're comfortable and I can wear my thermals with them. I need a jacket. Let's get under here. My britches are too big for me. That's a fact, always. Always. All right, I'm too big for my britches. Not today, boss. All right, keys. All right, what do I need? All this. Don't poke your eye. I like to just poke my eye with that screwdriver. Because I'm moving too fast for my own ass. All right, let's get in here. Worst comes to worst, I might have to kick you off the phone, boss, to go look at my damn YouTube video, but I think I got it. We're about to see. Oh, come on. I had it. One-handed. All right, so what we're going to do here, we're going to remove this. Oh, snap. Hold on. First of all, let me see. One, I need the flathead. Oh, I can do the flathead. So there's the exhaust cover. I got to take this, I think that's a C clamp. I got to loosen that up. I got to take this out, take the cover off, and then I can get down in there. Please say a prayer for me. I probably maybe should have smoked some dope before I did this because I don't have no patience, and sometimes marijuana. Sometimes marijuana. No, I'm joking. I've been chilling out. I've been good. I've been a good girl. I'm looking for somewhere to put you guys. Can you sit right? Oh, sorry. All right. A little bit of caffeine never hurts. He said to push it down. Did. Oh, do I have to pull up on that? Bruh. Here we go. It's difficult. Oh, I did push it down. Oh my Lord. I can't even make it halfway. Seriously. I mean, do I have to take this off? Because it don't look like he wants to come off, boss. I feel like I can get that oh, no, it's on top. Shit. Push down. It ain't coming out. Oh. All right, man in the chat. I need a man in the chat. Why ain't it coming out? Push it down. Why ain't it coming out? Do I need to pry it the fuck off? See it go up? Watch. Oh, hold on. Let it come into focus. Up. Come off. Tab. What tab I did? Oh, on sides? No, that ain't coming out. And I pushed. So I'm gonna push it back down. Black tab on the front. No. Does the whole fucking thing come out? Or just the top? I think just the top comes off. Yeah, just the top comes off, but I don't know how. I don't want to break it. It's not coming out of there. Do I have to push down? Ugh. Hold on. Pull up the red tab and press the black tab in. Then pull. Hold on. Thank you. And there's no black tabs on it. It's just, I thought there was, but there's not on the side. Why do they make this shit so fucking difficult, bruh? This is easy. This should be easy. And he said to push down and pull up. You guys, over here, I'm gonna pull up a video. Goddamn, dude. Pissing me off. I've got to do this. I've got to get it fucking inspected. I have no choice. I'm not spending $300 at fucking Chevrolet to do something that I can fucking do myself. Shouldn't be this goddamn difficult, but every time I touch this son of a bitch, it looks so easy when he does it on the video. Wait till you see it on the video. You're gonna be like, damn, why is she having this much trouble? Because I have bad luck. Horrible luck. Oh shit, my parking brake's on. See? Shit, think I won't put this shit in a McDonald's parking lot. I don't give a fuck today because it's got to get inspected. So, and I got to have Wi-Fi. So we getting it done. McDonald's is right here in the same parking lot. Don't worry, we ain't going far. Pisses me off. Why they do that? They could have just made it standard where you damn push the tab down and it pulls out. But no! They gotta treat the son of a bitch like an OtterBox. They gotta build an OtterBox on it. The fuck is going on out here? I swear to God, this is exactly what I love. I love mechanic work. Like, I could do it all day long. Absolutely. I'm doing my hands. I'm physically moving. I'm getting shit done. I could do it all day long if they didn't make shit like this. If it's an old car, you know, absolutely. I want to go tinker. But this son of a bitch, I want to drive him off a bridge. Sorry, Betty. I love you, but girl, your insides need work. Come on, dude. Come on, dude. Come on. Get the hell up the road. I'm being nice. Will you go? Don't make me regret it. I'm on a mission. I got an hour. I'm on a mission. I'm losing daylight. Oh, God. Oh, my darling. Oh, my darling. Will you get the heck out my way? Oh, my darling. Oh, my darling. I'm gonna run over you today. All right. Computer. Phone. You only need a screwdriver, they said. Looks like I need a damn chainsaw. Looks like I need a chainsaw. You only need a screwdriver. Temperature. Yeah, I might have to, like, use this to, like, get around the edges. I'm just scared to pull on something too much because I got man hands with these man muscles, and I pull on something too much, honey, we mess up, and I'm gonna be, oh my darling, I'm stranded again. Oh my darling, I can't pay a pickup man. I can't afford nobody to come out and have to service my car because I done messed it up. You know what I mean? All right, my nose is running because it's cold. Damn it, no Wi-Fi. On the video, he just damn pushed the red thing down and then popped it out. Why they gotta make it look so easy, and then you get in there and it's like, nay. Try again in a day. Alright. My nose is running. I need a snot rag. Sorry. It's cold out there, man. It's like 30 degrees. I'm just little. Did he already? I don't need to know how to do that. I told you I was sick. I've been blowing my nose all day. I hate that. I want to see him take the little red thing out. Unplug the mass airflow sensor. Did he push it? Did he push and pull? Hold on 1 second. You can barely see his damn hand, the damn camera angle. Unplug the mass airflow. It looks like the whole thing comes out. I thought the cord probably came out. No, the whole thing comes out. Hold on 1 second. Unplug, remove the 4 airbox screws, loosen up the C-clamp, because you're going to have to pull the exhaust out that way. See, it's got to come out, off. It's 4 screws, that little damn port thing. I gotta look, hold on. The whole bottom, and then I gotta get in there. Got 2 Christmas trees, little things to pop out. And then I can just pull the battery out and put it in there. See, it's got that cover. That's to keep moisture out. It's not a hard job. It's just the way that they make stuff nowadays, I guess. No, you can't, because it's connected to the exhaust lid. And watch me do all this shit and this light bulb don't even fix. I'm gonna be. Is it 11? Yes, it's an H11. It's the right one. He picked out the right one. Alright. Okay. Alright. Can I, like, download this shit? Download. Let me download this. Hold on 1 second. And I gotta use the bathroom. So let's run up in the back. Jesus Christ. I ain't got but an hour of daylight, man. View. Alright, it's downloading. It's the black box that... Oh God, music. I'm gonna push and pull. Push on the red thing and pull up on the black. Now I know what it looks like. I couldn't remember the damn video, but I got it downloaded. I'm just gonna go over here and do it because I don't go back to Walmart. There was like workers looking at me and shit. It'll be fine. Go back to Walmart. People in this town are kind of weird. I never know who I'm dealing with, so I just kind of stay away from people because more often than not, weird in this town. I think it's that they got shit to hide, and they know I damn sniffed that shit out. Secrets to hide, you know, and they know I sniffed that shit out real quick. So a lot of people stay away from me because they know I'm a damn, they say snitch. Oh my God. This dumbass motherfucking bitch. Lord. Fucking speeding through the fucking parking lot. I looked. She was going so fucking fast. She come out of nowhere. Fucking Honda Civic. Go figure. Probably in a rush to fucking go get drunk. Stupid bitch. Fucking hate people on the road, y'all. I say that because there's nothing to do in this town but get drunk and methamphetamines. First of all, I'm parking on this curb so I can get a step up in life. All right, parking brake, keys. Oh, my head hurts already and I ain't even started. Why is this shit gonna be so difficult? Almost. Damn dumbass bitch went flying by doing 30 in a McDonald's parking lot. She's probably doing 20 or 30 at least. She's fucking flying. I ain't never seen nobody damn being that stupid. But here we go. Never cease to amaze me, you know? You might have to pry it off. I think it's a little weathered. Jeez. Swear to God, if I get shocked by this shit, what is the freaking problem, bruh? Y'all, that's not it. That's getting the wiring out. Son of a bitch. He just pushed down and pulled right the fuck up. Why don't mine work like that? And that's why them fucking videos on the internet. Because not every car is the fucking same, and it's damn. If I pull up on that, it's gonna pull wires out. I didn't see no wires on that other one. But that's the only way it looks like to get it off, because that bottom part ain't coming off. That don't move. That's made it into the plastic. Yeah, it'll come out, but the wires are gonna come out. You'll see. Because I'm gonna pull it out. Okay. It's gotta come out that way. That's the only way it can come out. I just don't understand why he was able to pull that shit out and this shit's like baked the fuck on. Like damn, somebody put damn Elmer's glue in here to fuck with me. Yeah, no. That's not it, y'all. I'm telling you, look. God damn it. Look. If I pull up on that shit, I'm gonna pull the fucking wires out the middle, bruh. You see? There's wires right in that green area. I phone in there. I can't get my phone in there. That doesn't come off. Can't I just unscrew this shit? Where'd that damn screwdriver go? Fuck this. Can't I just unscrew this and lift that piece off? I'm not taking it to Chevrolet. You want to pay for that? You got $500. I don't. Let me think. For some reason, my truck does not work like video. There's no way. There's cords down in there. Pulling up on that is going to mess up something. That's not how it damn comes off. Shit. That's not how it comes off. So I'm gonna do. Are you fucking serious? This shit. I wanna cry. This fucking screwdriver is so stripped that it won't even take the screws out. And I used to have a drill. This shit makes me so mad. That piece does not come out because there's wires in the middle. And the black part doesn't come up. Yeah, this is a Chevrolet project. Lovely. So I need a special. Give me a minute. Give me a minute. Give me a minute. First of all, I've got an 8, so I can get that cover off because I've got a socket. I don't know where my hair came from, but whatever. Second of all, I think I'm gonna have to go buy a special tool because will you get on? I don't think these are gonna fit in there. It might open it. Oh shit, yeah. All right. Damn it. There we go. That's exactly how this one's gonna have to come off because there's no way to get that red thing off, and here it goes. I don't know why I watch fucking videos and struggle thinking that I have to do everything the same damn way. No, I could get down in here and it might not come off. We'll see. But that thing does not, that cover does not come off. Those wires go all the way down into this black box. This is not a magnet, so just want to be careful and put this somewhere I won't lose it. In my pocket. I would have paid them damn $200 to do that for me. I'll set that down. All right, 2 screws, left pocket. Socket. What is that? Too big. Too big. It's a 9. I need an 8. Damn it. I'm gonna have to go find a smaller one. Hold on. Swear to God, if I ain't got no damn 8, I'm gonna lose my cool right now. I'll lose my shit. Please fit, God. Yes. It's a 5/16. Loosey, righty, tighty. Alright. that's right. Oh shit. Ain't got no. Oh my god, here we go. Brooke's little baby fingers can't get in here. Patience. Patience. I hope so. Ouch. It's cold. It's cold outside. Oh. I'm just gonna loosen them all up evenly a little bit so the one don't get stuck. Oh God, I can't see what I'm doing. I can't find the damn. Oh, this is tricky. Tricky. Oh. They got this son of a bitch at an angle on a line. You've got to be shitting me, you sorry sons of bitches. I swear to God, they got this son of a bitch right on the line. You can't even damn. I'm gonna have to go in manually. You son of a bitch, Chevrolet. Come on, Betty, work with me, bitch. Ugh. Y'all, I might have to go buy a fucking screwdriver because this bitch is stripped. Hold on, let me use the flathead. I think I can make it work. Hey. Come on, babe. You can do it. Yes. They got it right on a phone. You can't even get a wrench down in there. There's a fucking metal, I don't know, it looks like fucking Freon or something, yo. I don't fucking know this shit. But I learned something today. This is air intake. And that's a C-clamp. And we're gonna be messing with some Christmas trees in a minute. God. They got this son of a bitch in here. Let me go ahead and loosen this C-clamp up. Oh, thank you, Betty. You're such a good girl. She's a good girl. Oh shit, I gotta take this crossbar out too. Son of a bitch. And it ain't going back in. I don't give a shit. Because I'm gonna need to change that headlight again in damn 2 or 3 years, and I'll be damned if I'm doing this like this again. Annoying. So it looks like the C-clamp like scoots over, yep, so this can come out. Yeah, okay. Let me go back to this one. I think these screws are just old, you guys. It's coming, but I gotta force it. I think it's like stripped down in the damn thing. Some asshole. Damn, I have these damn screws. This damn thing. Let me make sure I'm not stripping these in as I'm trying to get this one out. These angles are killing me. Damn. Gotta get it right up on this wall, too. Alright, we're getting somewhere. My whole ass is in the air. If I'm just being honest, I wish I would have wore something now different, because alright. Oh no. got like damn wood screws in here. What the hell? Almost. Close enough. Alright, I gotta get this one out. Can't even get to it. Son of a biscuit. Hey, hey. Come on, man. Oh, okay, too. Oh, I gotta get down. Ow, 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 ow. Son of a bitch. Ow. Okay, that's killing my legs. Okay. We're gonna come right here. Get these out. See the angle? You can't get right there. It's a pain in the ass. How am I gonna get that shit out? You ain't got but 2 inches of space to work with, not even. It's kind of hard to do this holding a camera. I just wanted you to see these angles, man. You need room to get in here. You gotta get in where you fit in, right here too. That little one down right there, I don't know what you can see, but it ain't easy to get in here. And then this T-bar needs to come off. Looks like a 9 because this, I'll figure it out in a minute. Damn it. It's hard to get my hand in there. Is it not on the thing? Y'all, I gotta put the camera down. I can't make no progress. Progress, slowly but surely. Oh, I got a 35-gallon tank on this thing? Not like gas tank, right? Last one, hopefully. I got bad luck. There's probably like 25 more under here we gotta pull out. Clearly this is not what was listed on it because I had to take that whole thing off. This comes off differently. Clearly. I got it. Oh God, finally. Getting these back in is gonna be a pain in the ass. I'll probably start on that bottom one first to go and get it in there. Alright. Oh Lord. Where's my monster? Sorry. Side note. Also wanted to grab these other sockets so I can damn try to get that bar off because I'm going to have to get that out the way to get that out. Alright. Oh, damn it. Went everywhere. Almost. I think I need a bigger one. Yep, there we go. 10. That's close. Now, where the hell does that connect to? And does it just scoot over? Shit, that's under the thing. Son of a bitch. Let me just see if I can damn get this out. I'm loosening up that C-clip as much as possible. I'm just making sure there's no more. Yep, I knew it. I'm gonna have to cut this tie. It's a, hold on, let me see if it'll come out. It's connected. Maybe I can flip it over, but okay, here we go. How the hell does this come out? All right, this can come up, but see how that damn bar gets in the way? That's why they do it. People don't understand. I fucking hate Chevrolet. Hate them. hell? This damn cover. I ain't gonna be able to get under there. Or can I? No. I'm wondering if I get this off, if I can move it to the side though. We'll try it. Maybe. Maybe. What is the problem, boss? What in the fuckery is going on? Yeah, it'll move. It feels like it will. Move it and then move it back. Please, God, let this bar move. Maybe not. If something's blocking it on the inside, I can't see. I'm losing count of the bolts and screws, if I'm being honest. It's not gonna move. I was hoping it would slide, but there ain't no way. I fucking hate Chevrolet. Alright, well, I gotta figure out how to get this bar off. It's one of them damn T things. Oh, it just pop up. Yes. Yes, yes, yes. It should just pop up. Oh, son of a bitch. Son of a bitch. I don't know how to get these things out. Does anybody know how to get these plastic things out? The black ones? Does anybody know how to get the black things out? Because that bar has to come off to get this box out. It won't move. Y'all don't understand, and you're not here. I'm not an idiot. Anybody know how to get the black sockets out? That's the only question I have. Do they twist out? I need to get this front paneling up. If I can get the front paneling up, then I can get right there. So I gotta get that black socket out. Figure out how to get this cover off and be done with it. It looks like they'll just pull out, but this one ain't trying to come out. There's got to be a way to twist them out or get them out somehow, because there ain't no way to get under there. Where's that damn thing? Fucking hair's in the way. Oh. Damn it. I need that fucking clip out. Pull the middle, pop the middle out of, then the clip will pull out. Are you sure about that? I trust you, but like, okay, thank you so much. I love you. Thank you, Tom. Thank you. You're the best. The more you know, right? Thank God. Fuck that motherfucker. Never again. What did I say? I know what the fuck I'm doing. I'm not an idiot. I just, you know, I'm a very practical person. So once I can get in there, I'll figure it out. It's just, and if I had my phone on me and I wasn't on live, I would have Googled how to get that clip out. I had the same problem with the battery. Welcome to owning a Chevrolet, where they want to claim that this is for a front collision when what it is, it's a way for them to make money. Fuck that. This year we're doing it all ourselves. Here we go. My hand is killing me. It's okay. Sure beats paying $300. Because that's absolutely, y'all don't understand, labor. And then they would have absolutely charged me damn $60, $70 for the light bulb. It would have at the very least been $200. $60, $70 for the light bulb plus $120 for damn labor at the very least. Damn scam artist. Never to be seen again. All this trash. I ain't going through this shit again. And actually, I'll put that plug back in there because I want it to hold this. Well, maybe. Maybe not. Oh, there it is. Thank you, Tom. Thank you, thank you. Oh, and it even goes in a certain way. I see. I reckon. Hey! Alright. Shit. I'm nervous. Let me get all this shit out the way before I start dropping shit in the engine. Because I sure will. Son of a bitch died. I'm sorry. Don't worry, I brought a backup. One for each hand. Alright. Alright. Oh, alright. Let's see what I got going on. So I might have to cut that clasp, but I might be able to lift this up and over and lay it here without cutting that. Here, I'll show you. So I might have to cut that. It looks like it needs to be cut. It's wearing through the damn thing. I got this up. I'm gonna got all the screws off. We gotta get that filter out and the bottom. Just give me a minute. Hey, Andrea. I'm maybe messing something up. I might be effing around and finding out. It appears so. How does this come apart? Oh God, here we go. Oh, I see. I gotta move this back. How does this come out though? Oh shit. How the hell does this disconnect? Do I gotta pull hard? Compress those clamps with some pliers. What? Compress? What are you talking about? You're distracting me. No. I had a question. Do I pull this out? Men that know. Do I pull on this? Do I pull it? The hose clamp has nothing to do with it. Oh my God, will y'all shut the fuck up? My God. It's like people just are so stupid. Ooh, I feel movement. Do I have to like wiggle it out? I guess it's rotating, but it's not coming out. Yeah, of course. Gotta be a way to get this apart. Hold on one second. Where's my plier? My screwdriver. I might have to like jimmy it out. Yes, I'm gonna have to jimmy it out. It looks like it'll just slide out, but it's probably baked on. Trying to be careful. Okay. I'm gonna cut that just for shits and giggles. Okay. Unless it'll like tree. I can just pull it out. Okay. There we go. It just pulls out. You don't have to cut it. Come on, you son of a bitch. Oh, God damn, yo. Why is this shit not coming apart, y'all? Where would a clip be, Diddy? Here, I'll show it to you. This is nothing like the fucking video that's online. Nothing. That hole wasn't even in that other video. So I've already got the C-clamp off, look. And this is supposed to separate right there. See? And it twists back and forth. But it won't fucking come out. Yeah, I know. What the fuck? Good point. It should have done popped out. I don't know. It's like something has got it. And it's just this. It's just... Maybe I need to like twist it. God damn, you gotta pull that son of a bitch, I reckon. You gotta pull that son of a bitch. I'm scared to pull on shit. I got bad luck. Alright, it's out. Air filter. Not too shabby. Okay. How the fuck do I get this out? This should just pop out. Oh my god, here we go with this shit. I see a clip right here. Can't see shit, honestly. Okay. How? Oh, I see. There's clips. There's clips. Clip. 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 Oh, what the fuck? God damn it. Please, Jesus. Clip, clip. What is it? How is it stuck to the bottom? Can I get my little hand in there? Fuck no. Oh, shit. That's one of the damn things. I can get my hand halfway down in there. This shit is bolted to the fucking frame, y'all. Understand? How do I get this box out? It's supposed to just pull right out. The lie detector determined that was a freaking lie. Ouch. God damn it. Okay, so there's this little rubber bumper. How the fuck do I get that out? How do I get this rubber stopper out? That rubber stopper is what's, God dang it. That rubber stopper is what's holding it in. How do I get this shit out? It's like a cone head. It's a cone head rubber stopper that's holding this whole box in. And I'm wondering, oh my God. No, it's a 2017 Silverado. Chevy Silverado, and there's no specific vehicles online. It all says 2014 to 2018, which is crazy because I should be able to find a video online on how to do this, and the only ones that come up are the ones that say that. Oh no. Some of y'all are idiots, and I can tell by the comments you leave. There it is. Fuck this. Oh. Get. I won't be able to get that cover back on, but I might be able to change that light. I'm getting impatient, annoyed. It's cold. My jacket's in my fucking face. I have sensory issues. My hair's in my face. Some bullshit. Them damn truck videos ain't worth a fuck. That's what I need to do, apparently. Oh, got it. I don't know. Here's a test of truth. Truth. I can't get it, motherfucker. Trying to pull up for it. For a light bulb. You see, yeah, exactly fucking right. For a fucking light bulb. This is a communist fuck country in a nutshell. This. That shouldn't even be a thing. I'm pissed. I'm absolutely pissed. I'm pissed there's no videos online. I'm pissed this fucking box won't come out because of that stopper. I don't know how to get that stopper out. Why is all my vapes dying? God, I charged them all this morning. Yep. Damn it, I can't even get under there. I can't. Shit, out. I got the cover off, but you have to get the bottom intake out. There ain't no way, it's impossible. There ain't no room in there to do nothing with that. I'm about to just pull it the fuck out is what I'm about to do. Oh. Because it's supposed to just pop out and up. There ain't no way to fucking... Yeah, it's that rubber stopper that's got it blocked. How the fuck would I get under the engine, maybe? No, that fucking... My wheel well's in the way. It won't come out. Yeah, there's a way, though. Y'all are not understanding. Y'all are not here. You can't see it. You're not understanding. You can't even get anything around that knob. There's nothing to grab onto, honey, because it's right up against the fucking wall. There's no way to get anything under there either unless I try to fucking... Ouch. Use a screwdriver to pry it up. Oh, God. It's impossible. Maybe if I can shove it down in there as I pull up on this thing. I'm trying to shove it down in the hole. Shit. Fuck you, Chevrolet. Oh, God, I got it up, but it ain't coming out. I got that damn thing up, like it's gone. But it ain't come out. I think they have it bolted to the fucking floor, bruh. I really do. I think they bolted it to the fucking floor. And there's nowhere to fucking... There's no holes for screws. And I can't get my hand in there to change that bolt. I can't even reach it. How? I can't even see. I gotta get a light. Fucking sun's going down and now I ain't gonna be able to see this shit right now. What does it say? What does this say? How to change a headlight in a 2014 to a 2019. This is a 2017. So why? Every time I look up one of them damn car videos, they don't damn work. I'm just gonna watch it and make sure I ain't doing something wrong. I don't understand why it ain't coming out. It's like they got it bolted to the fucking floor. First of all, that air filter don't even look like my air filter. That's the same box. Pull up on the lower air box housing. I did. I pulled that damn plug out and it still won't come out. It's bolted to this motherfucker. I pulled up on the lower. How much? Oh, shit. I was about to say, how much do I gotta pull? Apparently, all of your body weight. Why ain't the other side coming up? Oh, God. Hold on. Yo, I swear to God, they got this motherfucker bolted on one side. Oh, that don't fuck. Oh, I can't get down in there. lower. It's gotta come forward. It's gotta come forward. Oh, guys. There's no way to get this motherfucker out. I can't see shit. Oh my god. Fucking Chevrolet. Okay, that's connected to the wall. That's connected to the... Let this motherfucker come out, y'all. Great. That's in the wall. Okay, duly noted. First of all, I don't know why it won't come out. It's like bolted in the motherfucking truck or something. Seriously, it has to be. I done put all my body weight on it. I'm gonna fucking crack the frame if I keep pulling up. Shit. Ugh, it ain't coming out. Come on, baby. How do I pull this fucker out now? Oh, God. And they're clasped on the side. There's fucking clasp on the side! Alright, let's break some shit. Let's permanently damage some shit. Oh, God. Oh, I just cut my hand open, but it's okay! Ow! I got hurt in several places. I'm fine. I'm fine. Oh. Them fucking gobstoppers on the bottom. Fuck me, I'm gonna be bruised. Ow. Now the real fucking fun starts. God dang. Oh God. Where's that fucking video? Ow. Cut my hand all up. It's fine. You gotta pull really hard to get that motherfucker out of there. You're gonna have to put your whole body weight on it. I've already broke those off, so I have this problem again because there's a cover that goes over the headlight to keep the moisture out, so we don't need that fucking piece of shit that they put on there to cost you more money. Turn cover. Which way? You ain't specific. Oh God. Oh my God. Unplug what? See, this is what I'm saying. These fucking videos ain't worth fuck. What is he fucking talking about? Turn cover. Y'all. I feel clips. I feel like these things gotta go to the side to get that out. Oh God. This is the problem I'm gonna have. I ain't gonna be able to get this motherfucker. This is the problem. And I can't go nowhere now, so. Does anybody know how to get the bulb out? Counterclockwise. Turn about a quarter turn. Thank you. At least somebody's got a fucking brain around here. It don't work like that. Negative. It ain't turning at all. It don't turn like that. I feel clasp on each side. There's like 2 clasps that have it in there. Counterclockwise. There ain't no way. It won't turn. Actually, 3 clasp all the way around it. All the way around it. Lord have mercy. Should only have to pull it at least. Pull it. Ugh. That ain't it, y'all. I'm telling you. It's got clasp on it. There's clasp all around the motherfucker. Like 3. They do this shit intentionally, so you have to take it to Chevrolet. We have got to stop allowing these car manufacturers to do this to us, because it's not right. You should be able to do this easy breezy. It should not be this complex. Absolutely not. This is not my first rodeo. This is the first fucking rodeo I've ever had to do some shit like this. It's ridiculous. Ugh. There's fucking 4 clasps, bruh. How am I supposed to push all those clasps back at the same fucking time to get this motherfucker out? I'm literally about to rip this off. Literally bullshit that was unnecessary. All in the damn way. Can't even get to the damn thing because this piece of shit I ain't never watching one of them damn videos again and thinking that it matches my car, because they never do. Got all the idiots out. Sorry, y'all. You're not going to be able to see. You're not going to be able to see. You see those clasps? The silver things on top? And the side, see that clasp? See that clasp? How am I supposed to push 4 of those at the same damn time to get it out? The battery does not go side to side. I've already tried. It's not a standard fucking pickup, I guess. I don't freaking know. It makes me mad. And it won't just pull out. Off. It makes me want to go buy a fucking 1984 fucking Bronco. Seriously. At least I'd be able to damn work on it my damn self. I'm pushing, turning, and I'm pulling and turning, and it's not fucking coming out. There's even a clasp on the bottom. I don't know how to push all 5 of those back at the same time, if that's how that comes out. Oh my God, y'all. And I have no way to YouTube or anything now. This is some motherfucking bullshit. No way to get this motherfucker out. Ugh. I just want to cry right now. Like, I'm so fucking frustrated with this fucking truck. Like, people don't understand the way this country is headed. It's going to be to a point that every time your car needs something fixed, it's going to cost you $1,000. Just know that when you're buying these fucking bullshit cars that ain't got no fucking luxury to them. Nothing but a fancy ass fucking computer system that's a pain in the fucking ass that nobody can win. Just know it's because of technology. Oh. Literally freezing my fucking ass off. There's no way to get that motherfucker out. Like, I'm gonna have to take it to Chevy because it does not twist out. I'm gonna break it trying to twist it. It does not twist out, and there's like 6 fucking clips around the entire device. And how are you supposed to get in there? Like, I can pull them back with my fingers. Sticking in there is gonna get you fucking electrocuted. I can pull them back with my fingers, but you can't pull all 6 of them back at the same thing. It doesn't work like that, unfortunately. I've already tried that. Trying it again. It doesn't work like that. It doesn't work like that. That whole video, it does not rely to my truck. It says 2014 to 2019 fucking way. Look at all the shit that I've had to do that was not even in the video. It does not match this make and model. His car is completely set up. Mine doesn't even have a bulb connector. That's what y'all are not understanding. Look, mine is nothing like that one. It's just a fucking device in there. That whole device has to come out. That's the bulb in it. If somebody can fucking find me a link to this truck, I would greatly appreciate it. 2017 Chevy Silverado Z71 LT 15. It's not even the same. I just realized that. It's completely different on the inside. Like, you know, listen, I appreciate people trying to help people by, like, putting videos out here like this, but don't put a date on it that doesn't match somebody's vehicle. Like, now I've got more fucking problems, you know, than I needed. Thank you. It's not LED. I don't even fucking... 2017 Chevy Silverado Z71 LT. You're not listening. Let me explain again. Here's the battery. There is 2 clips here, 2 clips here, 2 clips here, and 2 clips here. How the fuck are you supposed to push back 8 fucking clips at one time? It's got a fucking death grip on the motherfucker from the front. There's got to be a way to pull them clips back. There's 1, 2, 3, 4, 5, 6. There's 6 clips, 2 on the side and 4 on top and bottom. That motherfucker ain't coming out. I don't know how to do it. All I know is I need a fucking beer right now. Like, seriously. Come to the internet for help. Nobody fucking helps. But everybody calls me dumb. Come on, man. All these men in the chat, not one of them know how to fucking... No, I can't. No, I can't. The fucking exhaust is on the floor. No, I can't. I can't drive in here. You think I'd come this fucking far to put it back together and not get this shit out? God damn, I'm just slicing my fingers. And people wonder why I'm single. Because I can't find anybody that can answer my questions. These are my questions. I'm so sick of those fake ass videos. I want to report that video as misinformation. Oh, there we go. God damn, man. Why they make this shit so sharp? Come out. There's no way this motherfucker comes out. Alright, I gotta go, y'all, because I gotta find a video since nobody can help.